I think that's a great question. I think one important thing about it is you don't have to be dogmatic about how you decide who's transplant eligible and ineligible. Certainly there's many factors that I think you have to consider. I think overall level of frailty and index of comorbidities are important to consider. I think age is potentially less important. We have certainly seen data that patients who would be considered advanced stage can tolerate transplant well. So I don't think age should be the sole predictor or reason why a person should or should not have a transplant. That being said, I think what we do know about advanced stage is that as we age, most people do develop more comorbidities that would in general limit their ability to undergo a transplant. So I think while age is not an absolute reason not to do a transplant, it tends to track with other comorbidities as well. And I think patient preference is important. There are simply some patients who are not interested in a transplant, and I think there can be a variety of reasons for that, but I think all the above factors have to be taken into consideration. You have to have a thorough discussion with patients, discussing the data. The most recent data from the IFM 2009 trial that showed an improvement in progression-free survival with the use of autologous stem cell transplant by about 14 months. But still, it is not a cure for multiple myeloma. And so anytime I think you're faced with a discussion like that, there are some nuances that have to be discussed.